Hello, my name is Judy Lee Marrow. In this video, my co-authors at the University of Illinois and I will demonstrate how to obtain skull radiographs and apply objective reference lines for the evaluation of acquired dental disease in domestic rabbits. With a little bit of practice, this procedure is simple to perform in nearly every veterinary hospital and is useful to evaluate rabbits for both intra- and extraoral dental disease. We have no conflicts of interest to declare. First, I will briefly review the basics of this procedure with a rabbit skull. Two standard radiograph positions are used, a right or left lateral and a dorsal-ventral view. Oblique lateral and rostral-caudal radiograph views may also be useful to evaluate rabbits with dental disease, but are not covered in this video as objective assessment lines are not described for these views. Let's take a moment to define some terms that we will use in this video. The sagittal plane, or axis, divides the skull into right and left halves, while the horizontal axis or plane divides the skull into dorsal and ventral sections. These planes are helpful to keep in mind when positioning the rabbit skull and adjusting the skull position to obtain diagnostic radiographs. In the lateral position, the sagittal plane of the rabbit skull naturally tilts down rostrally due to the narrowing of the mandible and maxillary bones. To maintain the sagittal plane of the skull horizontally to the radiograph plate and generator, a small wedge is placed under the nose. The mandibular rami are positioned so that they are completely overlying each other. For the dorsal-ventral radiograph view, the incisors are manually placed into occlusion. In the dorsal-ventral position, the horizontal plane of the skull naturally tips down. To ensure that the horizontal axis is parallel to the plate and generator, use a small wedge to raise the mandible. In the live patient, the caudal aspect of the skull may also raise off the plate due to the attachments with the spine and the neck musculature. Tape can be applied to the caudal aspect of the skull to ensure it does not raise off the plate. To obtain well-positioned skull radiographs in the domestic rabbit, you will need a radiograph generator and table, a radiograph plate, radiation safety equipment, sedative medications, a variety of foam positioning wedges and tape, and software or a straight edge for applying objective assessment lines. Here a rabbit model is used to demonstrate these techniques. The sedated rabbit is laterally positioned on the radiograph plate with the plate in the tabletop position. A foam wedge is placed under the nose to maintain the sagittal plane of the skull parallel to the plate. The mandibular rami are palpated to ensure that they are overlying each other and there is no rotation of the skull in the horizontal plane. Assess the radiograph obtained for straightness. In a diagnostically positioned radiograph, the bulla should overlap by 90% or more, and you should not be able to see separate mandibular rami due to the complete overlap. If the bulla and the rami of the mandible are displaced in the sagittal plane, reposition the nose to make sure that the sagittal axis is parallel with the radiograph plate and retake the image. If the bulla and the rami of the mandible are displaced in the horizontal plane, you will need to turn the patient's head until the rami palpate evenly and then retake the radiograph. For the dorsal-ventral view, the rabbit is positioned sternally and the incisors should be manually placed into occlusion. A foam wedge is placed under the nose to maintain the horizontal plane of the skull parallel to the radiograph plate. A piece of masking tape is utilized to apply light pressure to the caudal aspect of the skull to maintain the mandible in contact with the plate. Again, we will assess the radiograph for straightness. The mandibular symphysis should overlie the nasal bone by 90% or more. The maxillary incisors should be well defined and separated. No mineralized tissue from the maxillary nasal bone should be visible rostral to the maxillary first incisors. The zygomatic arches should be symmetrical. And finally, the temporomandibular joint should be partially to completely obscured medially by the rami of the mandible. If the zygomatic arches are not symmetrical, rotate the head in the sagittal plane until it is straight. If the mandibular symphysis is not overlying the nasal bone, place the incisors into occlusion and retake the radiograph. If the incisors are not present as individual structures, there is mineralized tissue present rostral to the maxillary incisors, and the TMJ joint is visible, then flatten the back of the head with tape or raise the mandible with a wedge to keep the nose from tipping down and retake the radiograph. Once well-positioned diagnostic radiographs have been obtained, we can apply objective anatomical reference lines as defined by Bomer and Crosley to the images to diagnose and monitor acquired dental disease in domestic rabbits. On the lateral view, our first anatomical reference line is drawn parallel to the ventral mandible. The apices of the mandibular premolars and first molar should be parallel and not penetrate the ventral mandibular cortex. In this case, there is no retrograde elongation of the mandibular teeth.
To assess the apices of the maxillary premolars and molars, a reference line is drawn from the proximal most point of the nasal bone to the occipital protuberance. The calcified apices of the maxillary teeth should not extend past this line. In this case, the calcified maxillary apices do extend past this line, which is abnormal.
The occlusal plane of the premolars and molars should be parallel to the previous reference line. A line is drawn at the level of the rostral hard palate just caudal to the second incisor and extends to the level of 1/3 the height of the tympanic bulla. The occlusal surface of the maxillary and mandibular teeth should be the same length. In this case, the maxillary occlusal surface is slightly longer than that of the mandibular teeth.
Although there is some variability in rabbit breeds, lines applied to the ventral maxillary interdental space and the dorsal mandibular interdental space should narrow rostrally. These lines can be used to track changes over time in individual rabbits. However, if these lines are parallel, pathological tooth elongation is present. On the dorsal-ventral view, reference lines are drawn from the medial edge of the mandibular ramus to the buccal aspect of the first incisor on the ipsilateral side, and from the lateral aspect of the bulla to the buccal aspect of the contralateral incisor. All of the apices of the maxillary premolars and molars should lie within these lines, apart from the apices of the second and third maxillary premolar teeth highlighted in orange in the magnified view. In this patient, there is palatal displacement of the second to the last and the last maxillary teeth highlighted in green.
To better evaluate patients with abnormalities like these, it is recommended to pair radiographic findings with a complete oral examination. In addition, right and left 40-degree oblique radiographs and craniocaudal radiograph views may be further helpful in diagnosing these patients. Thank you for watching this video. We hope that you will incorporate well-positioned lateral and dorsal ventral skull radiographs to aid in the evaluation of domestic rabbits with acquired dental disease in your practice.